Initially, I wasn't going to do any videos for this section because they were pretty well taught, but I found them beneficial for myself, so I figured I would continue on as much as I can. So I hope you guys enjoy. First section we're going to cover is intellectual disabilities and some pre-section questions. First, we have 3 criteria for defining intellectual disability. What are 3 criteria for defining intellectual disability? Next is 5 biological causes of intellectual disability. List 5 biological causes of intellectual disability. So diagnosing intellectual disability can be accomplished through the following mnemonic: 18 years of artificial intelligence. So onset before age 18, deficit in adaptive behavior, and lastly the deficit in intellectual function. So kind of corny, but I found it helpful. When determining how to categorize or measure intelligence, they utilize the IQ score. So the average IQ score is going to be 100. Now to determine what is below average or severely below average, which would be 2 standard deviations below the average, that score happens to be 70. So any score below 70 is indicative of intellectual disability. Now there are 2 large categories that can lead to intellectual disability that are biologic in nature. First you have chromosomal, and then you have infectious. Now chromosomal causes are Down syndrome, also known as trisomy 21. Then you also have Fragile X syndrome, which is caused by a mutation on the chromosome 10, which both lead to intellectual disability. Whereas infectious causes are mainly due to torch infection, and those include toxoplasmosis. The other category, you have rubella or German measles, CMV, as well as herpes virus, particularly hepatitis B, as well as HIV. And if you remember in the others category, those are going to include syphilis, parvovirus, varicella zoster, as well as Coxsackie. Now toxins also play a role in causing intellectual disability. Such toxins include fetal alcohol syndrome and lead and mercury poisonings respectively. Lastly, premature birth is also associated with intellectual disability. There's also a term called normal genetic variation, and this is also often referred to as cultural familial retardation. And this, as you'll see, is when social or psychological factors such as people who weren't exposed to the world or didn't have proper stimulation as a child end up with severe mental retardation or intellectual disability. Now, treatment for intellectual disability consists of 3 phases. There's primary, secondary, and tertiary treatment. So primary is mainly prenatal treatment, so planning for pregnancy, amniocentesis testing, as well as ensuring prenatal care and ultrasound are done appropriately and as scheduled. Now, secondary and tertiary prevention are quite similar. Essentially, the goal is to prevent or reduce the extent of disability. Secondary prevention is going to be more group-oriented, targeting high-risk children, etc. This can include Head Start programs as listed here, whereas tertiary prevention is more individualized for a patient, and it's going to be assessment-based. And these can be include medical screenings such as screenings for PKU. And there's also normalization. Normalization is just simply trying to get patients with intellectual disability to live as normal a life as possible. Now the answers to our questions from before, the 3 criteria for defining intellectual disability. The 3 criteria for defining intellectual disability can be described by the mnemonic 18 years of artificial intelligence, or AI. And those criteria are going to be an onset before age 18, adaptive deficiency, and intellectual deficiency. Number 2. What were the 5 biological causes, or more specifically infectious causes of intellectual disability? And those are going to be the torch infections. You have toxoplasmosis, the other category including parvo, Coxsackie, syphilis, and varicella. R is going to be rubella, C, CMV, and H, the herpes viruses, including HIV and HBV. Next, we're going to move into autism or autistic spectrum disorder. Now, our next set of questions, we have what is going to be the DSM-5 criteria for autism spectrum disorder. What is the DSM-5 criteria for autism spectrum disorder? Number 2, what medication can treat OCD-like symptoms associated with autism? What medication can treat OCD-like symptoms associated with autism? Number 3, what medication can treat aggressive or impulsive symptoms associated with autism? And then lastly, what is the diagnostic criteria for ADHD? Now, as you remember, Asperger's is no longer a term that's used. Now we have high functioning, normal autism, as well as severe autism. Each of these have various differentiations as well as require different specific treatment measures. There are several characteristic symptoms of autism. However, diagnosis can sometimes be challenging, especially since children will sometimes develop normally in up to 40% of cases, but will regress in the skills that they have learned. Also, these children are typically have a normal looking appearance, and you will have no idea that this child does have autism. So the things you need to look out for are going to be um, unusual fixations on objects. They're going to have these repetitive behaviors. If you remember, they just want to stimulate, so they are constantly having these repetitive motions, such as opening and closing the fist, for example. Um, Other common symptoms include a delay in communication. Typically, they won't speak until much later in their age than they are supposed to. And they're also not going to maintain good eye contact with you. You will almost look like they're ignoring you. Now, there are several key terms that are associated with autism. First is going to be dysprosody. This is a speech disorder characterized by alterations in the intensity, timing, and rhythm of the words. Also, you have echolalia, which is a repetition of another person's spoken words. Third, you have failure to individuate. This is when you have a delay or inability to gain or develop an individual personality. Lastly, there's gaze aversion, which is just kind of not making eye contact, which you described before. So it's important to remember these repetitive behaviors. This is also emphasized a lot by Dr. Levine. And I've actually seen this in real life. It is quite obvious, and you definitely notice it when you see it. Children with autism also have unusual sensory sensitivity, so they are very sensitive to certain stimulations, and they don't respond normally how those without autism would respond. Probably the worst, in my opinion, symptom that children with autism can present with is the inclination for self-injury. Remember, these patients require multiple stimulus, which is why they have those repetitive behaviors, and this also predisposes them to um, dangerous activities such as repeatedly banging their head on the wall or the floor. And it's important to note that these are not and should not be interpreted as suicidal or trying to make self-harm. They're just trying to simply get that stimulation that their brain thinks that it needs. Lastly, and probably the coolest feature of autism for me is that there is this inclination or this predisposition that some of these patients can be very high functioning in certain fields such as art, music, and mathematics. Now, DSM-5 can be diagnosed based on 4 criteria. First is going to be a persistent deficit in social communication. Number 2, they're going to have that stereotyped or repetitive behavior. Number 3, it's going to occur in early childhood. And lastly, of course, it has to affect the ADLs. If not, it would not be considered a psychiatric disorder. Now, the cause of autism can be varied as well as not entirely understood. Um, About half of cases occur through inheritance, whereas the other half are due to environmental causes. Now, unfortunately, there is no cure for autism. There are several different factors that can impact the outcome of these patients. First is going to be whatever IQ they develop, the quality of their speech, and overall this will lead to a change within the severity of the disorder. So there is no single medication that's used for all forms of autism. Typically, you're reliant on treating specific symptoms. So for hyperactive or ADHD type symptoms, you're going to give them a stimulant such as methylphenidate or dextroamphetamine. If they have OCD-like symptoms, you can try an SSRI such as fluoxetine or sertraline. You could also try atypical antipsychotic or neuroleptic such as olanzapine. If they are aggressive or impulsive, you're going to utilize a mood stabilizer. These includes carbamazepine, valproic acid, gabapentin, or lithium. Other options include clonidine, which is an alpha blocker, as well as beta blockers, specifically propranolol. So here's a chart with the several generic and brand names of those medications we mentioned previously. I definitely think it's worth looking at this slide. Now for non-pharmacologic therapy, you have what's called applied behavioral analysis. This is a type of behavioral modification whose ultimate goal is to identify very specific behaviors and gain control over these said behaviors. Next up is ADHD. Now, ADHD is defined by DSM-5 based on 4 criteria. First, age. Onset or symptoms must begin before the age of 12. 2, there must be persistent pattern of inattention or hyperactivity, and these must be persistent for at least 6 months, and it could be either or, inattention or hyperactivity. And these symptoms must be present in at least 2 or more settings. Now, symptoms of ADHD will differ according to age. Now, all of these different age groups will have some variation in decreased attention or hyperactivity. However, there is a distinction based on the amount of time that the patient can undergo certain activities. So I consider this my 3-10-30 rule. So in preschool age children, they play for less than 3 minutes, whereas in primary school, their activities last less than 10 minutes, and adolescents less than 30 minutes. So 3-10-30. You have 3 for preschool, 10 for primary school, and 30 for adolescents. Whereas in adulthood, they don't really set a time limit. It's just mostly the symptoms that you would think of associated with ADHD. Now, the social implications of ADHD are pretty self-explanatory. You have divorce, unemployment. These are just due to the symptoms that you would just normally consider associated with this disorder. There are also several associated features of ADHD, and this is going to include problems with social relationships. They tend to have a lower overall IQ score, which leads to learning difficulty, as well as poor emotional regulation. Now, the goals of ADHD treatment is overall to reduce symptoms, improve educational outcomes, and reduce problems within schools and families. And this is going to require an individually tailored treatment regimen, which is going to be individualized for the given patient. Now, I've always found the use of stimulants in ADHD is almost counterintuitive to what you might imagine. These patients are hyperactive, but we're giving them something called a stimulant. Never really made sense to me. However, it has been found to increase the alertness, arousal, and attention in these children, which is caused by an increased activity within the central nervous system, which is why people who are taking tests often take Adderall, for example. Now, the first medication we're going to discuss here is methylphenidate. Now, methylphenidate is a stimulant that works by inhibiting the reuptake of dopamine and norepinephrine. So these are neurotransmitters that when the reuptake is inhibited, will stimulate CNS stimulation. Now, because it is a stimulant, it can lead to some serious side effects, including tics, psychotic symptoms, increased blood pressure, and growth retardation. Now, the tics, the psychotic symptoms, and the increased blood pressure are all pretty intuitive due to the nature of it being a stimulant, as well as the growth retardation. Due to constant stimulation, the body is less likely to be able to grow. Because remember, that is a parasympathetic response because you need to feed and breathe. That's a parasympathetic response. So a non-stimulant medication that can be used in the treatment of ADHD includes atomoxetine. Now, atomoxetine is an SNRI. It has a 24-hour effect, so it can be dosed once daily. Some side effects include anorexia and insomnia. Now, this next medication, which is an alpha-2 agonist, is probably never going to be the answer to any questions regarding treatments. However, it is important to know what it is. It is normally used for hypertension, but it can be used for ADHD. It's less effective, has more side effects, so it should only be tried when stimulants are not tolerated or not available. Now, guanfacine is another medication, such as clonidine, which is a alpha-2 agonist. It is normally used for hypertension, but can be used in the setting of ADHD. Now, a benefit of this medication is that one of its side effects is somnolence, so it can help the patient sleep at night and lower themselves from that hyperactive state. However, you do want to worry about hypotension, so make sure you're dosing this medication appropriately. Now, probably the last option in these ADHD patients is going to be the tricyclic antidepressant imipramine. It works by inhibiting the reuptake of norepinephrine as well as serotonin. However, this drug is cardiotoxic, so it does require EKG monitoring prior to treatment. So, large amount of side effects, narrow therapeutic range. It's not going to be recommended first or second line, only in last case scenarios. So third line medication is going to be imipramine. Remember, that is a tricyclic antidepressant. Now, the answer to my questions from before: what were the DSM-5 criteria for autism? What are the DSM-5 criteria for autism? You're going to have a deficit in social interaction. You're going to have stereotyped or repetitive behaviors. There's going to be present in early childhood, so symptoms will present in early childhood, as well as they will affect your ADLs. Number 2, what medication can treat OCD-like symptoms associated with autism? What medications can treat obsessive compulsive disorder-like symptoms associated with autism? These are going to be SSRIs, as well as atypical antipsychotics, specifically olanzapine. Number 3, what medications can treat aggressive or impulsive behaviors associated with autism? What medications can treat aggressive or impulsive behaviors associated with autism? Those are going to be mood stabilizers, specifically carbamazepine, valproic acid, gabapentin, or lithium. Other options include clonidine or propranolol. Number 4, what is the diagnostic criteria for ADHD? What is the diagnostic criteria for ADHD? It has to be an onset before age 12. You need inattentive or hyperactive symptoms for greater than 6 months, and these symptoms must be present in 2 or more settings. Once again, thanks for listening. I know our lectures in class for this subject was actually pretty good. However, I found it beneficial for listening to my car ride due to this lecture only taking about 20 minutes to get through. So, yeah, I hope it's helpful. See you guys.